Good morning and evening for all participants and friends. I thank the organizers for this invitation and the opportunity to give this talk. And first of all, I need to clarify that as many of us, I am not an expert on COVID-19. So what I did to prepare this talk was to review the literature on the subject in relation to child poverty, taking into account 4 aspects. First, my experience as an Argentinian researcher on issues of childhood poverty and self-regulation and development. In second place, a focus on poverty. In third place, a global perspective, what is not easy. And finally, a humble science of learning perspective. I share with the organizers a link to a folder in Dropbox where you can find all the material I consulted. It's about 55 papers and reports from different countries and multilateral organizations. And there is a lot of information there that is difficult to summarize for a 20-minute talk because of the variety of experiences in different regions, countries, states, or provinces, and even cities and neighborhoods. And I apologize in advance for not including many of the involved topics with adequate levels of aggregation. This is because of my talk condition. What is clear to me is that uncertainty still reigns in all orders and sectors. We need more than ever to foster intersectorial and interdisciplinary collective efforts. What I prepare in first place, what I'm going to do is summarize different impacts and challenges of COVID-19 pandemic on child development. As I said, I will focus on poverty, health, and educational perspectives based on research and reports from different countries and regions of the world. In second place, after presenting such a summary, I will remind basic concepts of poverty and child development generated in the field of contemporary developmental science that especially I find useful to organize different scientific and policy actions for our purposes as a network. And finally, I will refer to potential future directions in the areas of health, education, and science of learning perspectives, which were proposed in the last 6 months by different academic and multilateral organizations. Global human development as a combined measure of education, health, and living conditions could set back this year for the first time since the introduction of this concept in 1990 by the UNDP. Specifically, it's estimated that GDPs will decrease, that there will be an increase in unemployment, a reduction in wages and income, and less access to social protection. All the current estimations concede that the decline in human development will be much greater in developing countries. Until last February, the most critical threats to children were those derived from the crisis in climate, poverty, migration, malnutrition, lack of access to adequate housing, education, social protection, and the commercial marketing of harmful products, especially from the food industry. The COVID-19 pandemic is exacerbating many of these threats, and the harmful effects will not be distributed equally. It is expected that the more damage will be the children in the poorest countries, cities, and neighborhoods. And in this complex context, there are 3 main channels through which children are affected by the crisis. First, the infection with the virus itself. That is a topic for physicians. I am far away from this expertise. Second, the immediate socioeconomic impacts of measures to stop transmission of the virus. And third, the potential long-term effects of delayed implementation of the preventive actions, such as those proposed by the SDG, the Sustainable Developmental Goals. Based on a recent report published by the United Nations, all of this is affecting children in multiple ways. From a health perspective, the most important issues are the following. The strategies to contain COVID-19 seem to affect key social determinants of health, such as employment, social interaction, and family relationships. People with complex needs, vulnerable populations, and marginalized groups are at increased risk from COVID-19 and the health effects of containment strategies. An estimated 42 to 66 million children could fall into extreme poverty as a result of this crisis this year, adding to the estimated 386 million children already in extreme poverty in 2019. Economic hardship experienced by families as a result of the global economic downturn could result in hundreds of thousands of additional child deaths in this year. In socioeconomic fragile settings, a lockdown policy can exacerbate health inequalities, and the consequences need careful consideration to avoid reinforcing the vicious cycle between poverty and ill health. Vulnerable groups and health inequalities are evident both in developing and developed countries. For example, Human Rights Watch has reported that the lockdown in India has disproportionately affected marginalized communities because of the loss of livelihood and lack of food, shelter, health, and other basic needs. On the other hand, the USA is a reminder of the divide that exists in countries without a universal healthcare system. For people who don't have private medical insurance, this pandemic might see them face the choice of devastating financial hardship, poor health outcomes, or simply both. Rising child malnutrition is expected as 368.5 million children across 143 countries who normally rely on school meals and must now look to other sources. In several low and middle income countries, maternal and child undernutrition rates are likely to increase as a consequence of the pandemic. Meals and snacks from schools or child care centers fulfill up to 2/3 of children's daily nutritional needs. All of this means that children from low-income homes, who are already at higher risk for poorer health and academic performance than children from high-income homes, may be further disadvantaged by nutrition shortfalls. The risks to child mental health and well-being are also considerable. Each new situation that the pandemic demands in homes implies socio-emotional and cognitive self-regulatory demands, which as they accumulate can be associated with fatigue, lack of concentration, and sleep difficulties. Lockdowns and shelter-in-place measures come with heightened risk of children witnessing or suffering violence or abuse, something that Roberto mentioned in last meetings. Children in conflict settings, as well as those living in unsanitary and crowded conditions such as refugee settlements, are also at considerable risk. Among them, the most vulnerable are those who have been separated from caregivers. Sorry. In past health-related disasters, up to 30% of such children met the criteria for post-traumatic stress disorder. Parents may also struggle to provide the responsive parenting needed to help children thrive during the pandemic. Many children have been or continue to be unable to play or socialize outside the home. Adolescents especially can suffer when deprived of social stimuli, since peer interaction is key to their development. In addition, many children and adolescents are spending more time online, allowing social interaction for some, but also increasing the risk of exploitation, bullying, and intensified commercial marketing. From the perspective of the educational issues, it's interesting to know that in 188 countries have imposed countrywide school closures, affecting more than 1.5 billion children and youth. The potential losses that this impact may accumulate in learning and development are hard to estimate these days. More than 2/3 of countries have introduced a national distance learning platform, but among low-income countries, the share is only 30%. While school districts are engaged in distance learning, reports indicate wide variations in access to quality education instruction, digital technology, and internet. Before the crisis, almost 1/3 of the world's young people was already digitally excluded. School closures worsened the learning gap. Children from wealthier families continue schooling with digital tools, whereas poorer children fall further behind in the majority of countries. The experience of virtual learning during the pandemic has varied widely and raises significant concerns for educational equity. Research during the pandemic shows that students from low SES backgrounds have less access to electronic devices, internet connectivity, and quality virtual learning programs. Owing to these inequities, students may experience additional months of learning loss in comparison with other students. Communities are also struggling to identify the resources required to deliver quality educational experiences, either in person or virtually. And also, they are struggling to identify education solutions that serve children in their district equitably. Schools will also need to contemplate alternative instructional strategies, what means pedagogies also, to allow improved access to virtual learning environments for students and their families. Parental and school district considerations for education are being heavily focused on safety, as they should be, of course. Those parents and students from schools in low SES neighborhoods face with concerns about whether schools have the resources to reopen safely. For districts offering a choice between in-person and virtual learning, some families may not have the opportunity of choosing a virtual option owing to a lack of employment flexibility and or lack of access to electronic devices and internet connectivity. Additionally, they may depend on the resources and services provided in schools, such as nutrition, physical activity, and health services. Chronic absenteeism, even virtual, or missing 10% or more of the school year, can affect educational outcomes, including reading levels, grade rotation, graduation rates, and high school dropouts rates. In some settings, children might be less likely to resume schooling due to increased rates of early pregnancy, as occurred, for example, in Sierra Leone after the outbreak of Ebola virus disease. Students in rural and urban schools districts are faced with different challenges in accessing internet. In some urban areas, as many as 1/3 of students is not participating in online classes. Part of the lens of equity needs considering and understanding the implication of closure for families with children with disabilities, something that usually is invisible or in silence. In many public schools, for example, students receive special education. In addition, some children and adolescents have complex medical conditions. These populations are heavily reliant on schools for services to help them learn and develop in a healthy manner. During the pandemic, children with disabilities have struggled to access services remotely, and special education teaching and rehabilitation services such as physical, occupational, or for example, speech services, normally provided during the school year, have been difficult to provide in a virtual environment. Owing to safety concerns and inadequate staffing, pushing services into homes has not been an option for most of these children. Regarding future directions based on this complex panorama, I don't know if you know the HUE UNICEF Lancet Commission, but the commissioners of this commission currently says that currently countries' responses have focused on short-term business relief and social protection, what for me is absolutely understandable, and not on the long-term recovery needed to create healthier and more equal societies. So for this commission, for the near and far future, they propose that it would be desirable that countries' leaders put child health and well-being at the center of recovery plans, include experts on children's issues in the relevant task forces and legislative working groups, engage their ministries to work together for children, and ask children and adolescents what changes they would like to see. For the Commission, putting children at the center of this scenario implies a radical change, which means redesigning neighborhoods to give children spaces to play, valuing care work, ensuring families have time and resources to raise children, ensuring sustainable food systems to nourish growth, and stimulating development and learning. Applying relational developmental systems, health determinants, equity, and rights approaches to guide strategies for COVID-19 containment and recovery for both could be useful, I find it useful, to deal with the complexities of this crisis. The RDS framework, sustained by the contemporary developmental science, propose that the several aspects of child development require considering different levels of organization and dynamics, from the individual to the cultural level, and that the developmental evolutions implies multiple interdependencies that in turn imply a multiplicity of possible trajectories for different children or groups of children. In such a context, I find useful to classify the multiple social and health determinants of child development in terms of whether they function as risk or protective factors. Mostly, all these determinants are directly or indirectly related to self-regulatory and learning skills. In this framework, it's important to remember that the impact of poverty is a function of at least 4 factors: the accumulation of risks, their co-occurrence, the individual's susceptibility to the impact of risk factors, and the time of exposure to them. So these developmental science frameworks could be useful to understand both the complexity of the impacts and at the same time the opportunities for primary and secondary prevention actions through, for example, the identification of different groups of children with particular needs, and consequently the rationalization of resources for actions and interventions. In such a context of thinking, future COVID-19 actions should target child health, well-being, and education in genuine integrated ways to rationalize investments of different kinds of resources. In general terms, this should consider the following aspects. From a health perspective, there is a need of strategies for investment in sectors that have sustained direct and indirect impacts on nutrition with the aim of strengthening the food supply chain and reduce food insecurity to assist those families and children at immediate risk of food shortages. Second, policy measures that aim to mitigate the health and socioeconomic consequences of the pandemic should consider how vulnerabilities cluster together across different household types and how this may exacerbate already existing inequalities. It's a very complex panorama. As many COVID-19 response strategies employed by high-income countries are unlikely to be feasible in low and middle-income settings, targeted health education and tailored guidance for public health response must be developed by careful consideration of low-income and disability perspectives. From an educational perspective, while levels of community transmission of COVID-19 may need virtual learning, it is important to identify and address the structural barriers that prevent students and families from accessing a virtual curriculum. While schools are closed, it's important to ensure that adequate resources are made available for remote learning and to maintain and expand student support programs. As schools begin to reopen, it will be critical to allocate additional funding to schools, universities, and other institutions. Funding will also be needed to ensure that the pandemic's impact does not fall disproportionately on the poorest and most vulnerable students. Regarding the reopening of schools, different countries are applying 4 broad approaches. Actually, this slide is unupdated because yesterday, or facing the new opening of schools, maybe we'll find more approaches. The first one in this slide is proposed to maintain school closures until a vaccine can be administered and sufficient levels to achieve herd immunity or a treatment is found. A second approach is to reopen schools completely once the effective reproduction number, the RT, is well below 1. Whilst this has the benefits of resuming normal schooling, it runs the risk of triggering further peaks in infection. Of course, the magnitude of this risk will become clear as the epidemiology of SARS-CoV-2 transmission becomes better understood, something that I will refer later on at the end of the talk. The third strategy is to partially reopen schools such that there are fewer students at school at any one point in time, enabling physical distancing. This has been the most popular school lockdown exit strategy employed thus far, with students typically attending for part of the week or in shifts. Finally, a hybrid approach whereby in-person classes is live streamed to those who, for example, need to be protected because of underlying chronic disease or have the capacity to study from home. The last 3 options I mentioned need to be accompanied by developing the surveillance capability, the ability to rapidly test and trace and isolate suspected COVID-19 cases and their contacts, and the capacity for regular deep cleaning of schools to minimize the risk of contact transmission. Especially in low-income countries, government action is required to prevent children and adolescents from being forced into the labor market due to individual or family vulnerability, and being exposed, consequently, to the risk of exploitation in the worst forms of child labor, something that is not very clear in many countries. Regarding the role of science, I have to say that in the field of health sciences, there are still pending questions that are not answered regarding COVID-19. For example, why do people respond so differently? What's the nature of immunity and how long does it last? Has the virus developed any worrying mutations? How well will a vaccine work? Or what is the origin of the virus? In the meantime, health sciences continue their efforts to solve these and other pending questions. There are other needs that the available amount of knowledge in these and other disciplines can try to satisfy. Research, advocacy, and collaborative work are among the first options to consider. Since the beginning of the pandemic, the social and behavioral sciences began to generate service and online platforms to explore the impacts on different aspects of mental health, well-being, and self-regulatory development. Actually, I mentioned some outcomes belonging to these efforts earlier in this talk. Many of these efforts have already been pre-registered, and we will have such evidence available soon. Collaborative efforts such as those of this network, our network, could be an opportunity to focus on generating questions, designs, and implementations of specific aspects of learning, and even apply for grants specifically oriented to these topics that many research agencies and multilateral organizations are offering these days. We are going to have an example soon in this meeting. Advocacy can consider the experience on evidence-based interventions, collecting new sets of information, and generating methods and algorithms for the analysis of information and decision-making processes. In such efforts, something that would be of central interest is to feed those efforts aimed at identifying specifically different groups of children and families with specific vulnerabilities and needs to prioritize and orient actions and interventions. One recent example that I suggest you to check of this type of effort is the program to simulate both poverty reduction and changes in employment and earnings generated by the National Academies of Science, Engineering, and Medicine Committee called a Roadmap to Reducing Child Poverty. There are other networks. Networks are also important for this crisis. As I have suggested, Solen, our network, has the potential to take advantage of the active exploration of the eventual opportunities that are appearing. And I want to share with you two other examples that I find of interest. The first one is the effort of several developmental cognitive scientists that are proposing to invest in an online collaboration for large-scale experiments that could collect data from families participating on the internet. Specifically, the aim of this proposal is to put the field working together to further expand and unify current prototypes for the benefit of researchers, science, and society. Another example is the SES and Neuroscience Network, which is in its beta stage, which offer information on scholars and publication in the field of the neuroscientific studies of poverty for researchers, policymakers, and other eventual stakeholders. More specifically for Solen interests, in the COVID-19 crisis with the schools closed, children at home, and parents expected to take on teaching duties, the science of learning could have at least two different roles. First, to offer guidance about how best to deal with the impact of the current situation, including lockdown and homeschooling. And second, to consider questions about what this large-scale educational circumstance might mean for the future. Among the main potential topics that we could consider to approach these aims are the following. Loneliness can increase stress, which in turn can affect health, well-being, and learning. Parental mental health is an important factor to support emotional and cognitive regulation in times of stress. Symptoms of anxiety and depression can correlate with the level of media exposure. Inducing new health habits, such as washing hands or don't scratch the nose, and this kind of behaviors that we need today, require that parents and eventually teachers can acquire and apply specific knowledge and behavioral changing. Since this type of learning can be slow and difficult, it is also important to manage motivation and frustration. These are appropriate times also to review pedagogies and learning strategies for different groups of children based on their needs and skills. The initial versions of education at home often look quite like the traditional teacher-led classroom, with teachers setting work to be completed at home, supplemented by some website or online tutoring for narrow skills such as spelling or arithmetic. But maybe, as was recently proposed by Thomas and Rogers from the Berwick College in UK, in London, technology in education can be used in other complementary senses, such as teachers serving as curators for virtual learning environments, or children exploring problems in new collaborative ways. In this type of environment, children can self-regulate their learning, switching to video tutorials or guidance from teachers when they need to learn new skills to proceed, for example. And finally, physical exercise, nutrition, and sleep are still important factors to consider in the context of the available resources and the limitation to foster learning skills. And this is my last slide. Governments, this is a sort of draft of conclusions in a very hyper-dynamic times, okay? So maybe tomorrow these conclusions are not be useful in many senses. But for now, for today, governments should expand critical programs for children from low SES backgrounds, including additional funding for medical care to cover rising demands on nutritional and clinical control needs. This is very important because the clinical controls in many countries are stopped now. In such a sense, many programs need an expansion of benefits to reach the rising number of families experiencing food insecurity and income loss, and in particular, evidence-based programs need investments to build strong foundations for child development and resilience. Other immediate needs include funds to address the digital learning gaps, including access to high-speed internet and versatile electronic devices, so all children can participate in distance learning. State social services agencies should receive additional funds to support outreach to families during and after the pandemic. Specifically, I mean, to address mental health needs, funds should support telemedicine access for children and their caregivers. Financial support should also be allocated for research that elevates community voices and explores the needs of communities that have been marginalized by the pandemic. In this context, there are several opportunities to be explored by networks like Solen. Investments are also needed to innovate in delivery mechanisms of health, education, and social services, particularly in a new paradigm in which social interaction is limited and will be limited for a while. As the economy recovers, governments must embark on a massive school infrastructure initiative to fund physical plant improvements to ensure that all children have healthy and welcoming places to learn, and ensure that all schools districts have resources for high quality instruction activities and school health services. And finally, in any eventual analysis and proposal in which we are going to be involved, I suggest that it would be necessary to consider in a non-naive way the multiple political, bureaucratic, and media dynamics which condition the implementation of actions for the different social clusters, especially those related to inequality. Thank you very much for your attention.
Thank you, Sebastian. That was wonderful. A lot to think about.
Yeah.
So we ask now that Elena Pasquinelli will respond and shed further light on the topic. Elena?
You're muted.
Microphone is off.
Your microphone is off, sorry. Yeah.
Can you hear me now?
Yes,
Yes.
much better, thank you.
It was another microphone. I was switched to one, but not the other one. So I will be very, very quick, and I wanted to thank Sebastian for this, at the same time, intellectually challenging and from a personal point of view, from a human point of view, very touching talk about the risks of that children are facing, have been facing, and now are facing even more. And I think that this calls everybody to action as far as what each one of us can do in his own possibility, her own possibilities. And I wanted just to illustrate two actions that we've tried to take here in France, following the kind of situation that Sebastian has described. Here in France, the lockdown period has been absolutely tragic for too many pupils, for too many children. We've lost 5% of our students from the radar of schools when we have closed the schools. We didn't know where they were, if they were following some kind of class, probably no. And we don't know if they came back in May when school reopened. This is tragic from the point of view of health, of course, because many of these children depend on school for their lunch, for at least one of their lunches per day. But it's tragic from the point of view of the gap, of the schooling gap that is being created. So some surveys are being taken in France in order to understand exactly the measure of this dramatic situation. And I think that measuring the situation is one of the first duties that we have, know exactly what the impact has been and for whom, in order to specify and rationalize our actions, as Sebastian was saying, targeting first children who have suffered more. Another thing that has been very evident here in France was the incredible gap between children and students in general and their capacity of being reached out when school reopened. So we've been closed for 2 months, then the children were going back to school. And we just noticed that during the 2 months of closure, so many kids had so many difficulties in following the lessons at distance, not just because of a lack of technology, which is a major problem, the technological gap, the digital gap, but because of different attitudes in motivation, in autonomy in schooling. So I think that we got to take one big lesson from the COVID, which will be a lesson forever for the future of education, which is setting some basic tenets of how education can reach everybody, how to simplify courses, how to provide feedback, how to make a lot of attention, give a lot of attention to the problem of attention, and to manage the attention of students in class and at distance. So one of the things that we've done as the Scientific Council of the Ministry of Education in France is to use this period of lockdown and post-lockdown to write down some recommendations for education, so for teachers, but also for parents at home, in order to exploit at best the learning capacity of children based on the best evidence we have in cognitive science and in the sciences of learning. And this, I think, is one of the first things that people in cognitive science and the science of learning can do to establish a list of principles for making education in these difficult situations for children in difficulty more public, and to use them, have them used in the future, not just in periods of crisis. And the second thing was to have, let's say, an optimistic attitude, to use this crisis as an opportunity to raise the critical thinking skills of our kids. We were talking before the talk of the difficulty of convincing people to wear a mask here in France, and in general, to have them understand what is an epidemic, why it behaves in a certain way, why scientists don't know lots of things, because this is too early, but still, why certain practices, such as wearing a mask or distances, can be useful. So we have exploited the coming back to school of children to create some pedagogical sequences of activities that are specifically targeted to children from 6 to 16 years old, with different activities for these different ages, in order to explain to children through hands-on activities in science what is a virus, why it is behaving in a certain way, how scientists do their research in this domain, and why scientists are more trustworthy than your friend writing an email or a tweet about drinking bleach and disinfect your throat, and also to empower children to become the messengers towards the adults, towards their friends, their peers in schools, of this understanding and of these principles. So to exploit, if you allow me to say it in this way, a bad situation to make some good, to raise the critical thinking skills, the scientific skills of children, because it is a need right now in order to favor good practices, but also because it is a preparation for many other situations. And I finish on just this other point. I think this is also the occasion to work with our pupils, with our children, on altruism. This crisis is showing that to everybody in a very evident way, how this world is connected and how each crisis make it more difficult for the people who are in difficult situations for poverty, because of poverty, because of disabilities, etc. I think we need to exploit this crisis to raise the altruistic skills, empathy, but also rational empathy of our children in becoming helpful towards the others, and teaching them to adopt certain gestures is a way of teaching them to be altruistic and to help other people. So that was the message I wanted to share with you. All the activities we have produced, of course, are online and available to everyone, the recommendations for the teachers, but also the pedagogical activities on COVID and on critical thinking. Thank you.
Thank you, Elena.
Thank you very much, Elena. And I've seen several notes already on the importance of what you have pointed out, what an incredible opportunity to promote critical thinking through the COVID experience and related to that. And of course, then you, as you've also pointed out in both your papers and in this presentation, getting students to focus on this as part of their lived experience and learning experience. I just want to stress, which I put in my notes already, that a recording of this is being made, so there's a lot of material being presented here, and we're all going to want to go back and dig even more deeply into. And so the recording will be made available on the website and also the materials. So let me turn now, if I could get the screen back. And so, yes, thank you. So let me turn now to Kumar Garg, the managing partner and head of partnerships with Schmidt Futures. And what part of the Global Science of Learning Education Network is about is what are some opportunities for all of us, and particularly those on this call, but in the international community that are doing such important work, particularly in this COVID era. What are some resources that could be available that some might be able to take advantage of? And so part of our ongoing video conferences will be those sorts of resources that you might want to be applying for, looking at. And so the first one that we wanted to profile was the effort by Future Forums on Learning Tools Competition by Schmidt Futures and Citadel. And Kumar, I'm going to leave it to you to explain, but I just, a personal note, you had a 2-day conference, and I see some of the people participated in that. A 2-day conference, July 20th and 21st, 1,100 people from across the world, all of us from our basements. And you, but it brought together, in some of the discussions that were held there, I found incredibly informative and eye-opening and hopeful. And so I will leave it to you, but thank you for holding this. Oh, one final note is I've never seen a competition where the funder makes it as easy to apply. And not only if you have trouble applying, they'll help you with researchers. At that point, I turn it over to you, Kumar.
Well, Bob, thank you so much for having me. And it's wonderful to be part of this group. I know when this was just a twinkle in your eye to create this global network. So it's impressive to both pulling it off and actually see it in person. And it's like wonderful to be, you know, I feel like you are you know, a source for wisdom and reason throughout our Obama years. So it's like great that you're continuing to carry the torch. And it's great to see so many familiar faces. I'm gonna like name check many of the people because so I think like good work is stealing liberally from others. So I see Bror here. And so we're gonna, you know, Bror here, Katrina, Ulrich, and others. So just to give you a little bit of context on me. So I served in the Obama, so my background is as a policymaker. I served in the Obama administration Office of Science and Tech Policy for just under 8 years, worked on a range of different issues, STEM, ed tech, kind of broader innovation policy, but got a chance to really, you know, interact a lot with our science agencies, so NSF, IES, DARPA, and others, and have been sort of involved in this world of ed tech and its intersection with research for some time. I left in 2017, what first started as an idea, then became Schmidt Futures later that year. And it's been a real philanthropic startup associated with Eric Schmidt and has grown to about 80 people. And we are doing a lot under a program that we call Learning Engineering, which we took from both its CMU roots and stole liberally from Broer as a really important way to organize our work. What I wanted to just do was just give a little bit of context as to like what the motivation of us creating a learning engineering program was, and then dig in on the tools competition that Bob mentioned. So I think the roots of this are really based on a conversation. I remember having dinner with Broer, maybe it was like 2010 when we first met. And the context of this was there was a talking point that we had in all our decks that we would talk about the EdTech revolution. And what we'd say is not only is the EdTech revolution important because of the affordances of technology, you know, oh, we can have learning anywhere, anytime, but we said, hey, you know, these sort of digital formats and digital technologies also have an affordance towards the research enterprise, which is that as you have computational biology appear, it not only is, you know, going to facilitate the delivery of healthcare, but we can actually ask a different set of questions by actually saying, you know, this cancer is spiking on the genome in this place. That doesn't tell you what's causing the cancer, but it allows you to have a different way of clue finding. And we said, oh, these sort of digital formats and more people living on these digital formats will allow us to have a totally different way that researchers are actually finding what might be working. And especially for education, which is so context dependent, you know, the prior knowledge of the learner, the context around the, you know, the educator, everything else, you know, being in these sort of complex, you know, environments might really matter. The thing was, I used this talking point in 2010, and 2011, 2012, and I had this like, you know, this can transform the way research is done. And, you know, I have to say that I didn't actually notice the step change in the, like, the way we were sort of interacting with the research community, which is, it wasn't that like, there was this burgeoning field where, you know, a quarter of the papers that are happening in education research have a, you know, an N of 500, of an N of 1,000. You know, everyone would say, oh, did you see the Carol Dweck paper where they ran this mindset study on top of Khan Academy and they got a 4% improvement? And people would give me that same example for like 3 years in a row of like an example of running an example on a platform. And I would say, you know, if this is like an actual field that's taking off, you know, I shouldn't be getting the same example every year for a couple of years. And so part of, I think, the theory behind the learning engineering program was to say, you know, building on the work that Katrina and Broer and others have done, was like really try to unpack why isn't the research community getting access to these digital platforms in a way that actually is helping accelerate the research enterprise. So the learning engineering program basically has three tracks of work. Track one is what we call sort of platform instrumentation, which is our goal, rather than doing the classic approach, which is, you know, hey, we're going to build this new tool. This tool is going to be used by 10 teachers or 500 teachers, and then someday 1 million. We're going to work backwards and actually go to the platforms that already have large amounts of scale, because getting scale in education is incredibly hard, and say, are there a subset of you that are really interested in actually developing deep relationships with the research community where the researchers actually get to ask the questions? And so this is like different than, although that is also important, than the efficacy literature. So we're not trying to say, does this tool work or not? It is saying, to what extent can these platforms actually be the place where we are running lots of experiments on the science of learning? So not only are we saying, oh, space repetition as a concept is important, but we're saying we're going to run hundreds of trials, and when you should bring the concept back. Should you teach it that night? Should you teach it the next day? What are other things that might matter? And what are ways that that system can work? And so, you know, the quick reaction I got when we first started this about a year ago was, why would any of the platforms be interested in this? You know, like, they already have scale. You know, what reason do they have to work with the research community? And I think that captures certainly the view of some, but what we have found over the past year is that there are definitely a set of platforms that have large numbers of users that are interested in becoming, you know, hosting dozens, if not hundreds of researchers over time, and actually being that platform. And so we've worked with Carnegie Learning, Infinite Campus. We've found about half a dozen already and are in conversations many more. I was able to host a conversation with Katrina right before the pandemic. It seems like before times in the beginning of February, where we had 60 major platforms come together, and lots of them kind of raised their hand for wanting to do more of this deeper work with the research community. Mark Schneider at IES has been leaning into this and talking about platform-driven research in the RFAs that IES has put out this year. So that's been one core of our work. What is the work identifying platforms that want to be these hubs where researchers can really drive? The second track of our work has been really focused on the talent piece. And here, the thesis is basically that computer science is the fastest growing subfield of the sciences, both on algorithmic innovation, but also just on number of students that are graduating. But one of the things we've at least noticed is that when you sort of talk about CS for good, AI for good, and everything else, education is like not on the top 5 list or even the top 10 list. Even though when you actually interview students, they're really interested in education, right? They feel a draw towards it. Most of them, if they have a CS background and you said, what's like a good example of using your CS skills for education, their answer is more like a CS for all answer, like teach the next generation to code. They don't actually have like, oh, Duolingo is an AI first company. Here's ways I can be using my technical skills to drive in this area. And so we've been really interested in trying to, given that denominator is growing so fast, what are the ways we create pathways for this computational talent to make its way into education? And that's been gratifying. We have an internal APM program where we take young, recent college grads with a CS background. We actually do have one that's embedded within Duolingo right now. And we've been developing lots of ways to sort of think about what does that talent pathway look like. And then the third part that we've been sort of interested in is just how do we build more of an integrated community in this area? ORIC helped launch a learning engineering listserv that has really grown and has become a really active way for researchers to interact in this area. We've been posing the question to lots of researchers around what are the image nets for education? Like what are the canonical data sets that if you could, sort of tag and put out into the world, you could get algorithmic innovation that's really interesting. So one of the things that ORIC is working on is, what is a data set of student writing that if tagged appropriately can improve our ability to actually do a better job of, assisting students in their writing. But, there might be other of those, which is voice recognition meets early reading and other sorts of these sort of canonical examples. So that's our sort of broad sort of frame, but we're sort of eager to get feedback because we're about a year in and would love to learn from this group and others around how best to organize our thinking. And obviously, there are probably many flaws in the ways we're approaching it. And so, candid feedback is of course very useful. And then the tools competition really came out of the fact that we said, not only does COVID put the role of online learning front and center in the political dialogue, but it kind of shows how far we are from actually having these online platforms be in this format of hubs for the research community. And so what are ways we want to facilitate that? So, we have a number of folks who are on this call who are actually, we haven't announced the judges yet that are going to be part of our judging process. We have an upcoming deadline of September 18th when all we're asking, as Bob said, is a 1-page, very sort of short proposal summary of what people might want to work on. And Ulrich and his team are eagerly helping people and helping develop that out. So if folks are interested in applying, with our support and Citadel support, we'll be able to give up to $2 million worth of prizes against this competition. We're hoping to draw in even more support than that down the road. And obviously this is not the only way that we're interested in this space, but it gives like an actionable way that, both, your peers, if you yourself, or if you've got sort of contacts that we'd love to get the word out. Because as folks know, people are busy, they're stuck in their houses. You just don't know who hears about what opportunity. And we'd love to get this on more people's radar screen. So that's like the quick riff. I'm sure Bob is happy to share my contact information if folks are interested in reaching out. And I'm also, if there's a few minutes, if folks have any questions, happy to cover those as well. But let me hand it back to Bob.
Thank you very much, Kumar. And I noticed Ulrich and I both put the Future Forums on Learning website in, which has some information. Also has, as I saw, complete recordings of the July 20th and 21st conferences. So let me ask if there are any questions for Kumar. since he's called out about half the group that's attending this video conference, I suspect everybody's already in ample contact with him, but thoughts, questions, suggestions?
I'll ask a question of Kumar. Kumar, I'm interested in the way you are thinking about learning engineering. I think of learning engineering as basically application of evidence from the sciences of learning and development to practical real-world learning and development problems at scale. I don't think of it as being a computer science specific activity. Do you want to say something a little bit more about how you see learning engineering as a whole compared with the really important subset of computer scientists getting more engaged in doing work on applying practical science and learning development results at scale?
Yeah, so I think that's a really good flag, which is that we've sort of approached much more the subset of the CS elements of the learning engineering discipline. And I think part of the reason why we wanted to focus on computer science, one was we thought we might have more credibility in this area. So we certainly had on the talent side, been able to recruit top computer science students. And I think, so partly was just, given Eric's background, we thought we'd have more traction. Partly also was just that I think because this is the subfield that's growing the fastest, if we can draw some of that capability towards learning, that would be really valuable. But I definitely agree with you that we actually want to pull from a number of different related disciplines in this area. And I actually find that the academic backgrounds of people doing the most interesting work come from a bunch of different disciplines. Like they were trained as economists, or they were trained as, cognitive scientists, or they have a psychology background. So the actual base degree pulls from different areas, which suggests that this is, definitely in an emergent area. But we've certainly focused more on the computer science elements.
Any other questions? Yes, I see Su Xiang.
Actually, yes. Dr. Saxford, I'm glad you brought that point out, because I was thinking of the opportunities between the information that both Sebastian and Elena brought up, and particularly in terms of the topic of poverty, science of learning. When Sebastian, you put the list of all the science of learning topics on that, seems to me that they all sort of come under a larger umbrella of the effects of stress on learning, right? Whether it's social, emotional, sleep, nutrition, whether it's chronic versus acute stress. And so there is an umbrella in terms of processes of learning, mechanisms of learning, and how they are affected by external factors. And Kumar, to that, I think it's really important to also think of technology affordances, in addition to sort of the basic science research on those issues, the technology affordances that may allow us to probe these kinds of processes even further, right? So given there is social distancing, for example, the issues of loneliness, social, emotional, how can you take processes of self-regulation that we know about to use technology to help and mitigate some of these stresses? So there's a lot of opportunities, research questions that the Science of Learning and Augmented Intelligence program at NSF is also very, I'm the program director for that, would be very interested. And it would be really interesting to see how the platforms that you spoke about could be a bridge to how some of these basic science research could be better integrated into elements that will be usable to the stakeholders, whether it's the parent at home or the school teachers or wherever. So
No, I agree. I mean, one recent example we just supported was a platform called Talking Points. You know, they send text messages. They help support text messages between parents and teachers, and their like core service is like they do automatic ML translation so that you can, you know, if a teacher and the parent don't speak the same language, they'll do it. But the interesting thing was, you know, they've quickly grown to 1.5 million parents on the service, and they're seeing these huge numbers of messages going back and forth. Some of them, you know, you can run lots of interesting questions around tone and stress. And when we asked them how many researchers they're working with, they said the answer was 0, right? When we said, well, what is your interest in working with the research community, it was quite substantial. And I think like one of our goals is how do we facilitate more of the infrastructure so that folks can say, well, actually, here's a bunch of different factors around you know, parental self-assessment that we could track against. Here's ways that this platform could help us test some of those ideas. And, you know, can we help facilitate some of that?
So related to that, you know, there's a lot of, so if I'm still going on the issue of stress, right? Diary writing is a way of expression for people under stress, for kids under stress. And there are now technologies, advanced technologies that are being developed with regard to assessing writing in a way that can help you get at questions of why writing could be a vehicle for looking at de-stressing, right? Because it's so I guess the question is, would there be also interest in projects that use the technology platforms in such a way to better probe the questions that we're interested in with regard to understanding of learning processes and mechanisms in a way that we couldn't have done before?
No, definitely. And I think it would be, we can happy to discuss offline too, but I think it definitely could fit both in the tools competition and then just generally as a area for discussion.
Okay.
So I might add one point to that conversation if I could,
Sure.
which is one of the challenges of going to scale from a narrow research finding to, you know, 10,000 or 100,000 students is you actually need a whole bunch of disciplines to coordinate the translation. It's just like when you take a chemistry insight and then try to put it into a factory that's going to make 1,000 or 1,000,000 gallons of the thing from the reaction that was done in the laboratory. It's not enough to just read the paper. You actually have to bring in a whole bunch of other sciences, of material sciences and the manufacturing of large-scale equipment and pumping and all kinds of things that the chemists, the scientists, don't know anything about. And the same thing is going to be true here. As you bring an important research insight to scale, you've got to surround it with other disciplines, whether it's, you know, making sure you manage cognitive load or making sure that you know, you're linking to what the students already have mastered and other aspects of it. And that's part of the tricky bit of going from a narrow controlled study to the much wider applicability of what's going on. There's an incredible potential there, but we've already experienced when I was at Kaplan a whole lot of tears around trying to take a narrow result and implement it at scale and wandering in the wilderness trying to figure out how come it doesn't work? Why doesn't it work? It should work. And it has to do with all the other variables you have to put in place to try to get the active ingredient to go out at scale compared to a controlled study. So I just wanted to sort of say something about that.
And I mean, this is why I got religion on this stuff from you, Bror, which was just that, like, I don't think we know the answer, but certainly one possible challenge we just face in education is it could be that because the situation requires so much of this context that, like, you really do need to run experiments at scale, right? Which is that, like, it might, the transfer model of running the small study and then leveling it up into large systemic replication might just be very hard to do given how education works. And so part of the reason why we've approached it more through the platform side is that it starts to get us in the direction of running these larger scale experiments, and then we can try to deduce what might be the underlying components that drive it, and that might be more fruitful than the other way around. I'm not making like a case claim that like that's the only way, but certainly building that out, that capability would be important.
You know,
But
Kumar,
Cedric,
a lot of us, I think, have walked into the Temple of Roar on this, and in the spirit of a great evangelizer and proselytizer. I know that a number of you have questions, and we're up against some time, but let me just note that Ulrich Boser has said that he'd be happy to answer questions about the tools competition, and he's put his email in the chat. We will also post that, as well as I would encourage you to go to the Future Forums on Learning website, which has all the information and a lot of the, as I say, a summary, recordings of the previous conferences. And I believe there's a webinar that's coming up again in September that you can learn even more about. As I say, anytime somebody invites me to present a one or to no more than 2-page concept paper and it gives serious consideration, I'm in. So I encourage you, particularly for something that's as important as what we're talking about. So I want to do just a couple, those of you who can, Andrea says that we can keep the platform open until 12:15 or till quarter past, or maybe a little bit thereafter, but a quarter past is probably workable. A couple of quick updates. First of all, those of you who participated, thank you, are in the first working group. We remember there are 4 working groups that everyone has agreed should be formed around science of learning and distance learning. What is it we're learning around social emotional learning? And the first working group that is up and running is the Teacher Support Network. What is it that our teachers need in this COVID era, particularly as affects teacher development and preparation. And a number of you participated in the meeting last week. We have, I think, working groups now emerging from that. Very exciting to see that underway. And I would encourage you, if you have interest in other topics, please let us know. Second thing is that please let us also know what topics you would be interested in having a video conference on like this, and is it one that you might be interested in helping lead yourself? Because the goal here is to bring together the best thinking on the science, the research, and then also how it applies to policy and philanthropy as well. And of course, with education and educators always uppermost. So Andrea, I think at this point, I'm going to turn it back over to you.
So thank you, everyone. I was both excited and perturbed by the talks, and I thought that we might have a bit further discussion on some of the talks. If our speakers are willing to stay for a few minutes, we can ask some questions. I love some of the ideas put forward too by Sebastian and Elena, and I want to further some of those. Using COVID as a learning experience for the children's very interesting, for example, and might have an impact in how safe they feel if they have more knowledge, which might impact actually the impact their brains and things like this. So I'd love to spur conversation in the direction of what sorts of things we can do, given that the situation is here, given that there are already children living in poverty, which we prefer to stop, but right now we're in that situation. So what are the things that we can do from sort of a grassroots approach? So can Elena and Sebastian unmute, please?
Elena, go ahead.
No, just one comment on what Andrea was saying is that before we started creating activities about the COVID, we were asked to do that also by the ministry, because there was this preoccupation about the stress of kids being at home, and some of them having full explanations, even too rich explanations about the epidemics and the danger of that. And one thing that was noticed by several psychiatrists in France was that there was a huge a huge amount of stress on children. On the one side, children thinking that they were a vehicle of infection for their grandparents. They would kill their grandparents just if they started breathing the air in the house with the grandparent close to them, and other children just don't understanding what was going on. And that was associated with a group of older children chatting on internet with their friends and having the most strange ideas about what was going on. So the idea of having children going back to school and being provided with clear, calm explanations, which were not just given to them, but they would experience what does it mean to wash your hands, what happens if you put something on your hands and you wash with soap rather than just with water, but also having a place, a safe place to talk. And so one of the things we did, in addition to providing these lessons, these lesson plans to teachers, was also to discuss with teachers and providing guidelines about how to talk with children in school once they were back. And one of the main advices we gave was to say, I don't know when they didn't know, which was quite important because everybody knows everything apparently about the COVID, and adults feel a little bit compelled to say they know, even when they don't know and they can't know. And for children, it is important to distinguish the things that are known by adults, the things that we don't know, and the things that I don't know it today, but tomorrow I will try to get some more information, good information, and try to answer your question. So this was in this idea of not just working on critical thinking, altruism, but also trying to create this emotionally safe environment. And I think that science can provide this kind of environment when you can say about this, we don't know. Sebastian, what do you want to say?
Well, it's not an easy answer for such a complex question, Andrea. Where put ourselves in this panorama? So I suggest to remember the 3 channels through which children are affected by the crisis. The first one is the virus, the infection itself. What Elena is suggesting, and also the BROR is suggesting something similar, to work with children and teachers about the feelings they have in the reopening stage. That is important, and that is related to the infection, to working about the infection with the virus itself. But I don't see scholars of science of learning from any discipline, besides the people that has in their hands the implementation of solutions. So there is an absence of us there, okay? So something important to do is to be involved, to understand that it's necessary to raise our voices in specific places in which the people that has in their hands the implementation of actions are working. So they are not going to ask for us if we are not going to ask them for being with them, analyzing the situation. An example in Argentina, my country, is that for the first 6 months of the quarantine, the pandemic, during the pandemics, the only people that were advising the president and the ministers were physicians, MDs, scholars in infectology. Now, the last week or 15 days ago, we could see that they invited a psychologist, a psychiatrist, for the first time. 2 or 3 people representing everything. That is one point. So we need to raise our voices in a very strategic way. We can use Solon for discuss about that strategy specifically, because something that we need to understand is that it's not happening the same everywhere. It's not the same being in Washington, D.C. than Buenos Aires or New Delhi, okay? So this variety is important because we can raise our voices in different ways in different places. So we need to discuss among us about what could be the strategies to do that in these very different contexts. Second, about the immediate socioeconomic impacts of measures to stop transmission of the virus, we have little chance to change what the politicians are doing, because that depends also in the fiscal balances that each country has. So there is not too much money in those, for example, in Latin America, a huge inequality region in the world. It's not easy to ask governments to derive some funds to do something from the science of learning perspective. Anyway, there are a lot of money spending for reopening schools, do something with the unions. We need to invite unions, or we need to go with unions to discuss about this, because unions now in Latin America are very important to modulate the implementation of actions. So we need to change our minds in many senses. Then about the inequalities, something that is very important for the science of learning community is that we need to understand that in many countries, there is a discipline that is not present in our discussion, and that is the social studies of infancy. They are mostly anthropologists, historians, and sociologists. And they are saying that the ways we are defining infancy, childhood, parenthood, rearing practices is not the only way to do it. It's not only one way to understand that. And we need them to understand how to identify different vulnerable populations of children and families, to grasp their needs in a genuine way, and to interact with the politicians, with them, to try to redirect some of the actions that we need to make during the pandemic. And this is a huge opportunity to make another kind of networks with other colleagues from other disciplines that we can, and I propose to don't think only for the pandemic period. This is an opportunity, it's a timely time, sorry for the redundancy, to understand that we have opportunities to do something after the pandemic, for the next decade, if you want. So maybe some mechanisms of change are better now for approach them than after the pandemic. So we need to discuss. This is another topic that we can approach in the SOLE. Regarding the potential long-term effects, in inequality societies like my own or my subcontinent, Latin America, because America is a whole continent, it's not only USA, for us from the South. So from this perspective, we are stopping fires. We don't have enough time or money or funds to do what we like to do, the perfect or the ideal stuff. We need to understand, and in this context, for me, the most important thing to understand is that we need to identify the diversity of needs that our children, adolescents, and families are facing. And politicians and academics not necessarily understand that in that way. So, for example, what Kumar is offering us is a good opportunity to put all this technology, and I want to recover what Susian said about this, because we can use the technology to identify this subpopulation of needs and kids and families. But for doing that, we also need other kind of disciplines like anthropology and history. Let me tell you, I want to finish this answer with the last thing I said in my talk. In my country, the political, bureaucratic, and media dynamics are modulating the ways of implementing actions, and not always in the good way. So maybe there is a place for us to interact with these social actors, to try to modulate from other perspectives what the families and children are needing now. I don't know if you understand what I mean when I say multiple political, bureaucratic, and media dynamics. See, a newspaper or a couple of newspapers can change a good action from the government just for other kind of interests, economic, corporative, or whatever. And that is happening everywhere. In Latin America, it's very frequent to understand. See what is happening with the newspapers in Mexico, for example, or in Brazil, or even in my country. And I guess I am not a scholar on that, but I guess that is happening the same everywhere because media is a corporation, it's a huge corporation. So we need to avoid naive positions as academics too. And remember that for many social actors, science is not being respected. We are not respected by many people. So we need to, how do you say, in Spanish is bajar del caballo, go down the horse. I don't know the phrase, I'm sorry.
Get
But
off
we
your
need
high
to,
horse.
thank you, Tracy. So that is important. We need to be humble and we need to think strategically about what kind of colleagues we need to work with and to interact with the politicians and other sectors. And remember that unions are very important to take in consideration for this kind of purposes. Thank you.
Thank you so much, Sebastian and Elena. There were a variety of wonderful comments made in the chat stream. I wish we could go on and on. I think Sebastian has given us a really nice ending with a lot to think about. And thankfully, I never had a horse, so we're good. And I would really like to thank everyone for joining us. And we'll be in contact with you for the next steps. It's always great to learn from each other, and then there's that point at which we really want to get going on doing a few things too. So if you're interested in one of our small networks where we're going to sort of take more tractable questions and propagate out, also please go ahead and enter on the chat stream before you leave what your interests are and what network you might want to join also, or how you might like to connect an existing network in. So thank you so much, and have a wonderful day. And we hope to see you in another month.
Thank you very much.
Thank you.
Elena.
Thank you.
Thank you.
Thank you, Bob. Thank you, Andrea. Thank you, everyone. Thank you.
Thank you.